1927, Austrian-American psychiatrist Manfred Sarkel accidentally gave too much insulin to a patient with a morphine addiction. The low level of glucose in the patient caused a coma, and the hypoglycemic crisis changed their mental state. This led Sarkel to believe this technique could work in mentally ill patients. He then began using it in patients with schizophrenia, with larger doses to cause a coma or sometimes convulsions. He published his work in 1933, and many doctors took to using the technique. He would spend weeks to months injecting patients with insulin, so they eventually fell in a coma. They would stay in the coma for about an hour before it was reversed with glucose injections. They would repeat this so the patients suffered 30 to 50 comas in total until they decided they'd had the maximum benefit and slowly stop. The patients would become pale, sweaty, and restless before falling asleep and later into the coma. They needed to be monitored constantly due to being at high risk of seizures and hypoglycemic episodes when they weren't having treatments. They were given extra attention and activities to avoid this. Patients became obese, and many ended up with brain damage, but a lot of psychiatrists wrongly thought that this was an improvement. It's believed anywhere between 1 to 5% of the patients died. Sarkel and other psychiatrists claimed there was an 80% success rate in schizophrenia patients. Others argued that it only accelerated remission in patients who would have gone into remission anyway. The consensus claimed a 50% success rate in patients who had been ill for less than a year. Between the 1940s and 50s, most hospitals in the US and UK were using this treatment. The amount of patients who received treatment was restricted because of the monitoring that was needed. In 1 year, only 39 patients were given the treatment, in comparison to 432 people being given electroconvulsive treatment. In 1953, psychiatrist Harold Bourne published a paper called The Insulin Myth. He said there was no proper basis for the treatment. He believes it only worked because a patient had a good initial prognosis and were therefore chosen for the treatment. In 1957, a control group of patients were given barbiturates to induce a coma, and the results were the same as using insulin. So it was the coma and not the insulin specifically. By the 1960s, antipsychotic medication had been introduced, meaning there was no need for the insulin therapy. However, some doctors still believed in the treatment, such as Dr. Harry Bailey, who worked in Sydney. He used deep sleep therapy with tranquilizers and barbiturates and kept his patients in heavy sedation for days at a time. When the treatment was made public in the 80s, it was revealed he was linked to 85 deaths, including 19 suicides. Bailey took his own life during the investigations. What do you think? Do you think insulin shock therapy should have ever been used? Let me know down in the comments, and don't forget to subscribe.